Well, good evening, everyone. My name's Paul Bucky,
And this is Bev.
and we are here with BioTouch Health Condition Workshop on addiction recovery. And we have a very special guest with us today, Michael Elissa Smotherman. Welcome.
Hi,
Hi,
thank you.
Michael. Welcome.
Hi.
So, the way we do this, we're just going to let Michael just start right out, and she's going to present just a wonderful presentation. And then, if you have any questions, please put the comments to us. Also, if you want the workbook after she's done, we're going to share how to do BioTouch for this addiction recovery. So, take it away, Michael.
Okay. Thank you very much. Thank you for asking me to speak. So when I was doing the research to figure out what I was going to say for 25 or 27 minutes, um, there, there's so many different, it's so multifaceted, addiction is. And what I found and just, um, well, I'll back up. So I work at a behavioral health organization here in Tucson. I work at the methadone clinic. Um, I have about 125 clients right now, myself. Um, and so I see addiction and recovery every day. I work with addicts who are still using. I work with addicts who have been clean for 10 years. Just all different, all different types. And um, let's see. So addiction really starts from pain and trauma. It Early childhood trauma, severe acute trauma, repeat trauma, even just little things that are traumatic. If you've got enough of them piled on top of one another, they trauma rewires your brain, creates new pathways, um, and so it's altered. Um, Things like neglect, abuse, systematic oppression. Um, so those things are what starts it, and then addictions. You can be addicted to obviously drugs. You can be addicted to food, work, anything that makes you feel better. You can be addicted to. Um,
Hmm.
I think that drugs feel like they're worse, but that they aren't. The addiction to food, the addiction to gambling, it it does the same thing. When you there's a flood of dopamine that comes in, and you do something. The the dopamine is the feel good neurotransmitter. It's like the brain's applause system. It says, "Oh, we feel better. We have this. We feel better." It's involved in what gives us the motivation to eat, the motivation
Hmm.
to do anything. If you don't have enough dopamine, you just don't really care. It's involved in depression and things. Um, but when you put something into your body like drugs, it floods. You get a flood of dopamine that you wouldn't normally get. And so all of a sudden, your brain's been hijacked by this kind of fake. It's not fake because it's your dopamine, but it's not something that you worked to get. Basically, um, you're you're kind of borrowing on something that you need later. Um, and there's all kinds of different things that are involved. There's oxytocin. There's the different hormones. The oxytocin is the bonding hormone. It has to do with nurturing and attachment. It's really big with heroin addicts. Heroin addicts a lot of times say that using heroin feels like a warm hug, so they get that comfort that kind of it's a nurturing thing. It's attached to mothers. Oxytocin's released when a mother breastfeeds her baby.
Hmm.
Um, so it works in that part of the brain. Um, I'm just looking at my notes. I'm sorry. So, right, all kinds of things can come in and can change your focus, can get you addicted. We have um, all kinds of things all the time that make us feel bad. We want to feel better. So we put something in. It, could be the internet, it could be video games. We just want to feel better. But when we get distracted by whatever it is and we can't stop doing it, if it starts to become detrimental to us in the long run, um, that's when it's a problem. Because there are people that can do these things. There are people they can play video games and then put it down and go on about their lives. They can, I don't know about heroin, but they can do other drugs, put it down and go about their life. It doesn't hijack their entire life. But when somebody has that underlying pain from whatever, the 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 brain and the everything. Sorry, I'm super nervous.
It's-
um, so you've got your all of that brain stuff, and it's confusing but basically when you don't have, and I'm just going to use drugs because that's what I know. Um, when somebody that's using drugs and they're addicted and they can't go without it, they try and get into recovery. They try to get clean. They have to detox off the drugs. They've got to get it out of their system. Um, but their brain tells them that they're going to die
Hmm.
if they don't have this.
Hmm.
And that's like their addiction talking to them. And so, because they feel so terrible. So I have a friend that relapsed recently, and he said every time he thinks about getting clean, he has a serious, severe panic attack because he feels like he's going to die. He knows logically he's not going to die, but that's what his brain is telling him, and that's what his body reacts to. Um, the There's a decision. So drug addiction, a lot of times it used to be a moral thing. Everybody said, oh, if you're a bad person, you're a drug addict, you're a bad. And then there's the disease model where addiction is a disease. Um, but the disease model kind of takes the responsibility away, because there is a responsibility for an addict. They have to make a decision that they are going to quit. They're going to stop doing whatever it is that they're doing that makes them feel better. They have to figure out other ways to feel better. That's where therapy comes in. That's where, the methadone or Suboxone comes in for opiate addicts. It replaces something and allows them to live a life where they get their medication every day. It's just like heart medication, any other medication. You take it once a day and then you go on with your life, instead of having to sit there and get high every few minutes. So there are all kinds of different ways. There a lot of people think that total abstinence is the way to go, where you don't put anything in. And that includes caffeine, that includes nicotine, because it keeps that addict switch kind of turned on. If you're you're in rehab and you're not doing drugs, but you're still smoking, that addict switch is still on. And so it doesn't allow you to completely get that out of your system and re-heal. Your brain is still trying to get the feel good, the excessive amounts of whatever it is that it wants. And so, but over time, it becomes harder and harder to stop, because you've got tolerance, and the tolerance, you have to do more of the drug to get the same effect. And so the things, they work on each other, kind of snowballs. The more you do, the harder it is to quit, and things like that go on and on. So let's see. Um, People have equated going through withdrawal to heartbreak, to being heartbroken, and it's that those brain chemicals that they're not getting uh, as much of as they had been, so they think that there's something wrong. Anhedonia is, the inability to feel uh, pleasure, to feel happy, and that happens too because normal things that would normally make you happy, they don't anymore because you had this flood of chemicals that was artificial. Um, and so it takes a long time. And brains they're a lot of plasticity. They can repair, they can rejuvenate to a degree, but it takes time and it takes uh, attention. And I think anybody that works with addicts needs to be cognizant of the pain and of the trauma. And it doesn't matter what that trauma was or what that pain is, um, because that's subjective, right? You as somebody helping, you don't have to know the details of what the painful experience was. You just know that they're in pain, and so that you help them to get out of it. And I think the less you know, the better sometimes, because you don't have bias, you don't have the, oh, that doesn't sound so bad kind of thing going on in your head. So you can just give to the person and help them. Um, I was saying before we started that at the clinic I work at, we've been around for like 40 years, and we have a couple families that 4 or 5 generations come to the clinic to be treated. Yeah, we've got the great grandma and the grandma and the mom, and it's just a whole line of them. Um, and it's crazy. And it's so hard to tell. Is that because, the 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 person, the mother before them was, not loving, so that's why they have an addiction? Was it genetics? What was it that caused it? And it's all of those things. So to help somebody and to help them get better, you have to look at all of those things. Um, Everything needs healing. Let's see. The parts of the brain that are involved in addiction, they're the same parts of the brain that are involved in survival. And it goes back to, thinking you're going to die, thinking you're not going to make it, which is why it's so hard for people to stop sometimes, especially like with fentanyl and the opiates that are out now. They're so strong that they can't go for very long. And so it's like the addiction is worse. Um, there's some really interesting studies out there, about why people get addicted, or how, for opiates it reacts in the same part of the brain that the mother's love, the bonding part. And so that's why a lot of times if somebody has issues with their mother, or their primary nurturer, if that's still something that they struggle with, it makes it harder to stop using, um, because they just want to feel better and they've got to feel it somehow. Um, yeah, trauma related to maternal figures, lack of healthy attachment, it can drive opiate use, as a substitute for that comfort. And it's the same with like the heartbreak and being in love, and then you break up and they can't get clean because they can't handle that feeling. Um, the there are all kinds of ways for people. There's community organizations, there's 12-step programs, there's, like I said before, total abstinence, there's medication, um, and it's not the same for everybody because everybody didn't get there the same. So it's kind of like when you're treating depression and you have to try all these different things to figure out what's going to work. It's the same sort of idea with addiction and recovery. Um, there's there's a Peter Cohn, I think, the he had a theory that people needed community, and they needed to be with other people, and that's what would help them recover from drug use. That if they just had other people around and didn't isolate. And part of that is true. They say when you start isolating and using drugs, that's when it's much, much worse. And that kind of thing. And I think it comes from that place. Um, I had a girl and her mother come into my office today, and the girl has done so well. Um, she had her kids taken and all of these things, and she finally decided, she made a decision that she was going to get better, and so she went through residential treatment, and then she went through a transitional, and now she's back at home, and she wants to get off of methadone because she doesn't want to put anything in her body anymore. But it's not, her brain has been changed. It's been changed from the trauma before the drug use, and then the trauma of the drug use. Um, and the drugs themselves have changed her. And so people need to understand that they have to go slow. They can't do it fast. They can't. Um, it's a long process. It took a long time to get to the bottom of wherever they got to stop using drugs. So it takes a long time to get better. Um, there are um, different modalities. There's EMDR, which is a modality that they use. There is Detox, which is auricular acupuncture, and that's very helpful for both trauma and addiction. Um, and in my job, I was trying to think, do I have anybody that's a client that I've met or interacted with out of the hundreds of people that doesn't have some sort of trauma? And I don't. They all could qualify as having PTSD, all of them. Um, and a lot of times, and you'll ask them, you'll do an assessment, and you'll ask them, have you ever had anything traumatic happen? No, no. I was in prison for 10 years, and I was a drug addict on the streets, and my mom left, but no, nothing traumatic. And it blows me away. So, I'll try and give an example, like a car accident or a divorce or anything, so that they know that those things are also traumatic. Even good things can be stressful and you know cause that. When I first got clean 7 or 8 years ago, I was fine when things were bad. I felt okay, but when something good happened, that was when I started, getting that feeling, those cravings for the drug. I didn't understand what the happiness feeling was. Um, so that's what threw me for a loop for quite a while. Um, and I've run into other people that are the same. Um, uh, there's so many things. As long as, I think, for somebody treating somebody with addiction, to help them, like with the biotouch, things like that, they just need to treat the pain and the trauma, because that's what it comes from. It stems from pain and trauma. If you don't have pain, you know, then why are you continuing to want to feel better? What do you have to feel better from? So there's that underlying, and I think that's part of the mechanism of addiction too, is why people stay in addiction, because of that whole brain thing. There's It's just so multifaceted. There's so many different things that go into it. You can't really whittle it down even very easily. Yeah. Okay. Like I said, so I work at a methadone clinic, and those are opiate addicts. Heroin, but not even so much heroin anymore. That's mostly fentanyl, which is local here and on the East Coast too. Um, and they can't get away from it. They can't stop. It doesn't really matter what they try. Some of them, because it's such a strong thing that they're putting into their body. Um, so it's scary, and it's hard. It's super stressful. I think for me, food would be the hardest thing to quit. I mean, because you can't quit it. You have to have food to live. Like if you're addicted to cocaine, you don't have to have cocaine to live. You might think you're not going to live if you don't have it, but you don't need it. But food, you need it. So how do you go about, you know, cutting that off? You can't, you can't do that. So that's always I feel really bad for people that have that as an addiction, because it just, you have to just do a little bit. It would be like just doing a little bit of cocaine every day, and not getting out of control, and that just seems horrible to me. Um, but just like anything else, anything out of balance is out of balance. Your body wants to balance and have that homeostasis, and it just can't. And so you put in drugs, you put in video games, you put in anything that floods it, you know, um, and it tilts it. It's off filter. So yeah, I think I've rambled long enough.
Yeah. Well, I'll tell you, you had Sarah who chimed in here. She goes, "You are amazing, proud of you." so,
Thanks.
so no, that was great. Yeah, I sort of like where there's a silent moment. Yeah, those are most of us just like the yak 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 yak, but the silent moment gives us time to absorb what you just said. So I do have a couple of questions. I
Yeah.
appreciate that you talked about the generational trauma, and that they're still looking into whether that's just the genes, or one, the mother got beaten, so she beats, and then that beats, and it goes on and on. And I watched some Gen Z young folks talking about how they've recognized that a lot of how they see the world is generational trauma, and they're trying to give a different dialogue to their children.
Yeah.
And so that's why we're wondering, how do you feel? I mean, you've had a little experience reading about BioTouch. How do you think touch can help us in our generational trauma? Hitting the dopamine and oxytocin.
Right. Well, I mean, and just that, like the mother and the baby, when they breastfeed, they both get oxytocin.
Hmm.
One of the reasons why they let babies cry, or why they said they should let babies cry, babies when they cry release oxytocin. So um that was a way to self-soothe. You have a baby that, and you let it cry, and it'll eventually fall asleep, maybe, because it self-soothes. Um, things like that. So uh, I think that anytime you can show compassion to another human being, it's beneficial. And I think that, you know, like I'm licensed to do AccuDetox, but that hurts. It's a needle in your ear. If
All right.
you're withdrawing or detoxing, you don't want to even be touched, let alone poked with a needle. Um, that's why I think BioTouch is such a neat idea, because it's like a hug. It's not a hug, but it's just that connection, that energetic connection. Somebody that wants to come in and exchange energy with somebody that is hurting, to try and heal them. So I think
Yeah,
it's really
that's interesting. Well, we worked at that drug rehab community, Amity, outside of
uh-huh.
town there. We were there
Yeah.
for 3 or 4 years, and we actually worked with the mothers who were incarcerated and were being brought back with their children. and we had a whole program teaching these mothers how to do this light touch with them. And then we had that therapist at Cope, your partner energy agency, who used to teach a lot of those folks that you work with how to do it, and they would touch one another in this very gentle like touch, and you could see people melt. It reached that dopamine, oxytocin, they just felt cared for a moment. So any questions, Bev?
I'd just like to make one observation I thought was really cool, and you asked her about BioTouch, but Dr. Kenneth Stevenson has called BioTouch this kangaroo touch. So when you were talking about that part of the brain that is looking for that nurturing, like from a mother, I couldn't help but, well, that's exactly how important BioTouch can be, because that kangaroo touch is that mother's touch that doesn't think about it. It just goes, it just reacts, to take, and I think that was a really great question Paul asked you about using BioTouch with people with addictions, because it seems to be with the trauma, the PTSD, the feeling of I'm going to die. These are people that need to be connected to other people. Yeah. And so that was a really kind of a great thing for me that you mentioned that nurturing part of it. Very important, I think.
Well, sure. Michael, we look forward to sharing more with you. Maybe come down to the Lafontaine and share some with people. That would be fun to do.
That would be cool.
Yeah. So we're going to teach the point. We appreciate you coming and hanging out with us. And you were a little nervous, but something, we'll have you back again. It was fun. Okay. You did a good job. Thank you.
Time around.
Bye.
All right.
You did great, Michael. Thank you so much.
Bye-bye.
Bye.
That was awesome. And really, I do like those silent moments.
I was good with it. I kind of remind me of when I was first learning, going through the instructor program. I was feeling her.
All right. So, folks, we're now going to teach you how to do the few sets of points to build on what Michael Elissa was talking about. Everything that we're going to teach you here can actually benefit. It meets the dopamine levels. The oxytocin. We've worked with generational trauma. We've had people talk about generational trauma, that parts of the brain. It can help rewire the brain. So we're going to teach you a few sets of points that you can do immediately. You don't have to be a pro at this. You don't have to be an expert. I've been doing this for 35 years, and I still don't consider myself an expert. So we're passing this on freely to you. If you want the workbook that Bev's going to teach us from, go to justtouch.com/workbook. It's free for the 30 days of this showing of this. Otherwise, you can participate in learning it later on and order it online. So we're just going to move and just go to the workbook, and that's what Bev's going to show you right here. So take it away, Bev.
Okay. So if you'll notice, the first page of our workbook is always dedicated to the condition itself. Just a little recap, some information to get us started, and how BioTouch can address the particular condition, and then some information about the foundation, our mission and vision statement. So that's the first page, just for you to get an idea of the underlying information about this condition. So let's go to this first page. It's page 6, and we're just going to go over what BioTouch is. For those of you who are new and want to learn a few things tonight, and for those of us who have been doing this for a while, it's always good to just kind of touch on those basic 4 bullets there at the top. So just to start, BioTouch is a very light touch on the skin. It's skin on skin. One person touching another person lightly on the skin is the definition of BioTouch. And this is a technique that is made up of 17 specific sets of points that we use to address any and all conditions the body can manifest. So it's a natural, it's non-invasive, and it's very, very effective, especially when two people are practicing BioTouch. So let's go over these 4 bullets. The first one, BioTouch, is easy to learn. So for example, tonight you are going to learn 4 sets of points. It's going to only take a few minutes for each one. And the moment that you do, you're going to be effective. You can start practicing them immediately. It's a complement to any healthcare program. It's also not just a complement, but BioTouch enhances any healthcare program you may be going through. A special diet, you're under a doctor's care, you're doing other modalities, it doesn't really matter. BioTouch is integrative. This new word in medicine, integrative, and this is what it does. It just matches and enhances anything else that you may be doing. It has no levels of ability. This is one of the great things that makes BioTouch very, very unique. All of us already have the means to practice and be effective with BioTouch already within us. The only thing it does take is wanting to help another human being with their stress, with their pain and suffering. So the only knowledge you need is to learn where those sets of points are. The first time that you use BioTouch with anybody, you're going to be effective. There's no time lapse or working for years or needing anything special. You've already got BioTouch. Just those first 2 fingers of each of your hands is all you need, and a little bit of knowledge about where the points are. And it requires no special preparation, no belief system. The foundation itself has no particular belief system. We honor everything because we know that BioTouch is meant for every single one of us, and we all come with our own belief systems, our own state of minds, our own choices that we've made. So BioTouch is amazing in that regard. Just again, the only thing that's required is that you want to help another human being in their pain and suffering. So we do have a few things that we kind of want to share with you that we do before we start practicing BioTouch. The first thing is we always want to wash our hands. It's again, one person touching another person on the skin. We begin every single session, even if the only thing you do is the greeting. This is the very first set that we're going to teach tonight. You're always going to use the first 2 fingers of both hands, touching on the skin like a butterfly. All of those sets of points are going to require us to hold each point in that set 6 to 8 seconds. You can practice BioTouch anywhere, with anyone, anytime. That is another unique, magical part of BioTouch. So this next page, page 7, you see at the top terms used in this manual. We are not going to go over those terms because these are the terms that we use in our trainings to help you find or help you to ways that you can touch on the skin. But we are going to share with you the first 2 bullets. BioTouch is a relationship of healing that involves 2 people. The associate, which is the person that performs BioTouch, that's giving the touch. And we use this because it is a convenience, but let's look at what the dictionary describes as an associate. 2 things. One, often in the company with another, which is implying an intimacy or an equality. That's the main thing about BioTouch and this relationship. And 2, one having an interest in common with another. So again, BioTouch is a relationship of healing. And what happens in a relationship is both people, the giver and the receiver, in this case, the recipient, are in an equal relationship. One is giving and one is receiving. However, the other way around. It's an equal exchange. That's just, again, another wonderful thing about BioTouch. It's always a giving and a receiving. So that's really basically the main topics we wanted to share before we start sharing these particular sets of points with you tonight. We're going to begin with the greeting, and I'm going to let Paul just kind of like explain to you how this is going to be set up.
So if you'll notice here, this workbook, somebody just asked us too, are just sets of points that come out of our entire manual. Yep. Okay, there's nothing new. We haven't created, we just made these little workbooks, but they're all pages from our entire manual, which is only 17 sets of points, and we're only going to teach you 3 or 4 this evening. But the workbook is designed with 2 pages for each set of points. So as you see here, we have the greeting, and at the bottom of the greeting, 1 page is going to be just this drawing with these numbers, and then where you should touch those points are on page 2, the definition of where those points are located. Now the fun thing about this is at the bottom of each of these pages, there's a little click here to watch the video. And if you click on that, it will take you to the video of which we will be watching this evening. So it's very easy to read where the words are, look at the pictures, and follow with the video.
Yes. Okay. Thanks, Paul. We're going to begin, as I said earlier, with a very important, probably the one set that opens up, is the key to the whole body here. It's called the greeting, and this is given to set up a harmony between the associate and the recipient and start to build that relationship between the two. The one thing about the greeting that's different from every other set is you're only going to use one hand, a specific hand, and that is your dominant hand. There's only 2 points to touch, so you're going to use the same 2 fingers on the same dominant hand for each one. And again, this is to establish a harmony. So let's go ahead and look at the video of the greeting.
The greeting is always performed at the beginning of each session. It's the only set that uses one hand and the only set that indicates which hand to use. The greeting is performed with the dominant hand. If you are right-handed, use your right hand. If you are left-handed, use your left hand. The greeting is made by touching at point 1, which is in the fleshy area just below the bottom of the breastbone or sternum. Hold this point for 6 to 8 seconds. Then, with the same 2 fingers, touch point 2 on the back. To find point 2, look for the big bone at the base of the neck. From here, move 1 to 1.5 inches to the left. This is point 2. Hold this point for 6 to 8 seconds. More than one associate may work with a recipient provided that all of the associates perform the greeting. If the associate or the recipient leaves the session, or if someone who hasn't done the greeting touches either the recipient or the associate, the greeting must be reestablished. Then the session may proceed from where it was interrupted.
Take it away.
Okay. All right. So we've established the relationship between the two, associate and the recipient, and now we're going to begin with the other sets of points we're going to share with you tonight. The first one we're going to share is the headset. And I think this makes sense because just about 90% of what Michael was talking about, it was the brain was involved, the hormones, the chemical imbalances, all of those things that are the dopamine, all those things that are secreted by the brain. And so we want to address this headset. It's a really great, if you do nothing but the greeting and the headset, you're going to be very effective. So again, anything that relates to the brain, we want to use the headset. So let's go ahead and watch the video.
The headset can be used to address conditions related to the brain. There are 4 steps in this set. In step 1, use through fire to touch points A and A. Point A on the back of the head is in the center of the neck at the base of the skull. Point A on the front of the head is at the center of the forehead where the forehead begins to curve to the crown. Step 2 is performed in crossfire with the fingers of each hand touching on opposite sides of the head. Hold at X, which is in the indentation beside the neck muscle at the base of the skull. It is the same as point 1 of the back set. On the opposite side of the head, touch points 1 through 5. Points 1, 2, and 3 are on the ridge line formed where the skull curves up toward the crown. Point 1 is above the outside corner of the eye on the ridge. Point 2 is above the front of the ear on the ridge. Point 3 is above the back of the ear on the ridge. To locate point 4, move down the head toward the base of the skull to a horizontal indentation approximately 1/3 of the way down from the top of the ear and 1 to 1.5 inches behind the back edge of the ear. Point 5 is opposite hold point X at the base of the skull. Point 5 now becomes the new hold point as points 1 through 5 are touched on the opposite side of the head. In crossfire, touch point 1 above the outside corner of the eye on the ridge, point 2 above the front of the ear on the ridge, point 3 is above the back of the ear on the ridge, point 4 is a horizontal indentation approximately 1/3 of the way down from the top of the ear and 1 to 1.5 inches behind the back edge of the ear. And point 5 is opposite hold point X at the base of the skull. Step 3 is performed in matching fire, touching points 1 and 1, 2 and 2, 3 and 3, 4 and 4, 5 and 5. Finally, in step 4, place the open palms of both hands on the head covering points 1 through 3. Be careful, don't let your hands touch each other.
Okay. The next set that we're going to share with you is called the metabolism set. And this is a great set to use because it really helps the body to assimilate and eliminate what it does not need and bring in what it does. So this is a very good, just a basic set that involves the whole body when you're helping someone trying to deal with addiction and things like that. So let's go ahead to the video and watch them practice it.
The metabolism set can be used to help the body assimilate what it needs and eliminate what it doesn't need. The metabolism set has 2 steps. Step 1 involves touching points in matching fire along the large muscles on the front of the neck. Points 1 and 1 are located above the collarbone in the soft indentations on both sides of the notch at the top of the breastbone. Points 2 and 2 are halfway up the neck on the front of the large muscles. Points 3 and 3 are at the top of the neck on the front of the large muscles. The second step involves holding a point on the front of the body and touching points next to the spine on the back. Hold point X on the front of the body is on a line directly between where the nipples would be on a youth and is 1 to 2 inches to the left of the breastbone. Another way to find X is 1/3 of the way up the breastbone from greeting point 1 and 1 to 2 inches to the left of the breastbone. The points on the back are located next to the spine, forming a rectangle around the breakover point. The breakover point is where the bottom of the rib cage joins the spine and can be found by imagining a line directly through the body from greeting point 1. To perform step 2, find hold point X on the front of the body and touch points 1 through 4 on the back. Point 1 is approximately 1 to 2 inches up from the breakover point on the left spine muscle. Point 2 is directly across from point 1 on the right spine muscle. Point 3 is 2 to 3 inches below the breakover point on the right spine muscle. Point 4 is used to address blood sugar problems and is added to the other metabolism points when needed. It is located across from point 3 on the left spine muscle.
All right. The next set is called the stress and anxiety set, and probably a no-brainer. Much of what she was talking about tonight, the body manifest things that are of an emotional or mental stress source. So, of course, going through addiction recovery, there's going to be a lot of stress and anxiety, as of course there was to begin with. PTSD and all those things set up all those kinds of scenarios. So this is a great set. It's very simple, but very effective. So let's watch the video of the stress set.
The stress set may be used to address any manifestation of physical, emotional, or mental stress, as well as anxiety and shingles. Hold at X, which is in the fleshy area just below the bottom of the breastbone. It is the same as greeting point 1. Then with the other hand touch points 1 and 2, which are the same points as in the heart set. These points are found by imagining a line running from the notch at the top of the breastbone to a place on the left breast where the nipple would be on a youth. Divide this imaginary line into thirds. Point 1 is at the top of the first third. Point 2 is at the top of the second third. These points may be touched repeatedly, and remember to touch each point for at least 6 to 8 seconds.
Okay, the last set we're going to introduce is called the infection, allergy, and poison. If you're looking at the workbook, you see these 3 small diagrams on the right. We're going to be looking at the one for poison. And the reason is because during addiction recovery, there are a lot of these toxins are going to be released, and this really helps the body to process and deal with releasing what the body's trying to get rid of. So this is a great set to use. Let's go ahead and watch the video.
The stress set may be used to The infection, allergy, and poison sets are 3 separate sets of points. They all share the same hold point, which is the same as greeting point 1, located in the fleshy area just below the base of the breastbone. As with all sets of points, these may be touched repeatedly. Infections of any kind anywhere in the body may be addressed by holding X and with the other hand touching point 1 which is at the base of the large muscle on the right side of the neck and slightly above and behind metabolism point 1. Allergies or allergic reactions may be addressed by holding X and with the other hand touching point 2, which is on the right side of the neck directly behind metabolism point 3 on the top of the large muscle. To address poisoning within the body, hold X and with the other hand alternately touch point 1 and point 2.
And there you have it.
It is. A great start.
Very easy to do. And I think we need to remember, as Bev said, you don't have to do all of them. If all you do is the greeting, you're going to have this moment. If you can do the greeting in the head, even if you just do A of the headset, some healing is beginning. Also, you don't have to do this every hour. I mean, if you do it once a day, if you're really in addiction recovery, otherwise you could do it every few days. And you're talking even just the greeting in the headset will take you, I mean, what did we decide, like a minute or two, you know?
Yeah.
Just doing the greeting though can bring this balance, this connection, that loving touch that probably with that A is going to activate these oxytocin and the dopamine levels. Yeah. We also had this neurological psychologist said that if you have this wow experience in your life, that's where changes happen in the deepest seat of consciousness, which is what we're trying to get to when we work with trauma. And he said, so go out and have those people do that touch thing with you. And interestingly enough, when anybody ever has a session, just the greeting and that headset, they open their eyes and they go, wow.
That's cool.
And just so you know, too, if you go to our website, justtouch.com, there's a little section called research. And Dr. Kenneth Stevenson, who we talked about, did research and created what's known as the stress chart. And drug addiction and those things are all part of those constant stressors, DNA, genetics, and all these other traumas in our life. Just driving out on the street can be a trauma. And she showed these constant stressors put a toll on our body, and she showed how putting BioTouch into it can actually help us with healthy aging. So
Yep.
we're here to help you learn how to use BioTouch. So contact us, justtouch.com. Download the workbook. You can get the whole manual if you want. You can join us every Monday. We talk a little bit more about BioTouch. If you're here in Tucson, come into the center. We do all of our sessions on a donation basis. We can also work with you through Zoom. I'm actually going on a Zoom thing tomorrow morning to teach these two ladies how to work with a thyroid problem. So
Perfect.
it's easy to learn, simple to use, and profoundly effective.
Profoundly.
Profoundly. Bev, thank you much.
Thank you, Paul.